Hello, my name is Sarah. Thank you for watching this instructional video for the Menopur injection. You will need the following: 1 vial of Menopur powder, 1 vial of sterile diluent, syringe with 22 gauge, 1.5 inch mixing needle, 27 gauge, 1/2 inch needle, alcohol prep wipes, gauze, and a sharps container. Check to make sure that the vial of sterile diluent does not contain any free-floating particles. Remove the cap from the vial of Menopur powder and the vial of sterile diluent. Disinfect the top of the vials with an alcohol prep wipe. Remove the mixing needle and syringe from the packaging and remove the cap of the needle. Hold the needle upright and draw back the plunger to fill the syringe with air. Hold the base of the vial of sterile diluent and pierce the top of the rubber stopper with the needle. Gently apply pressure onto the plunger so that the air transfers from the syringe into the diluent vial. Invert the syringe so that the vial is upside down, but still attached to the syringe. Pull the plunger back slightly past the 1 ml mark. Remove the syringe from the vial and set the vial aside. Insert the needle into the rubber stopper on the vial of Menopur powder and release the syringe's content into it by pressing on the plunger. After releasing all the liquid into the vial of Menopur powder, gently mix the contents until the powder dissolves. Do not shake the vial. If your dose is more than 1 vial of Menopur, repeat this process using the solution in the syringe to mix up to 5 more vials of Menopur. Invert the syringe without removing it from the vial and pull the plunger back until all the contents from the vial transfer to the syringe. Once finished, carefully remove the needle from the vial and recap the mixing needle. Remove the mixing needle by twisting it off the syringe and placing it in the sharps container. Remove the 27 gauge 1/2 inch injection needle from its packaging. Twist it into place on the tip of the syringe. Hold the needle upright and remove the cap. Don't let the needle touch anything, including your hands. While holding the needle upright, gently tap the side of the syringe until the air bubbles migrate to the top. Apply slight pressure on the plunger until a drop of liquid appears at the tip of the needle. The injection is administered in a subcutaneous site specified by your physician. The most convenient site for a subcutaneous injection is in the abdomen around the navel. If your physician has specified that you are to administer this injection differently, for example, intramuscularly, please proceed as directed by your doctor or nurse. Wipe the injection site with an alcohol prep wipe and allow the skin to dry. Make sure to alternate the injection sites between both sides of your body. Take the syringe in your preferred hand, pinch a fold of skin between your fingers and insert the needle at a slight angle. Release the skin after the full length of the needle is inserted. Push the plunger until all the medication is administered into the injection site. Gently remove the syringe and apply pressure with gauze. Dispose of the used syringe into the designated sharps container. Thank you for watching our MedEd video.